Non-profit organizations are also being challenged by coronavirus. Mould Empower Serve operates in Hillbrow, Kempton Park, Cape Town and Port Elizabeth, helping homeless and vulnerable communities. Well, let's chat now to its CEO, Leona Pina, also joining us via Skype this evening to see how it's affecting them. Leona, good evening, and thanks so much for your time. So how is coronavirus affecting your work in these communities?
Good evening, and thank you for the opportunity. It is going quite against our nature. We had a long discussion again this morning with the leadership team where it's in our nature to be hands-on. It's in our nature to really help people close up and personal. This situation is calling for us to change our approach and still be relevant to the community we serve. Our major concern at the moment is we can accommodate them in our shelters because all our shelters are below 100 people per project. But the problem is if we need to isolate people, where do we isolate them? If we have people homeless on the street, where do we isolate them? So those are some of the questions we are currently facing, as well as how to increase facilities where they can actually improve their hygiene as well as wash their clothing, since this also affects their clothing. So we are making quite a few changes. All our creches, all our after-school programs, all our holiday programs has been cancelled for our children. Our major concern is how do we make sure they still have access to nutrition during this period. We will have an emergency supply of disposable food packs that can be collected at very controlled environments in all our branches. So that is something that we're trying to put into place to be still relevant. The same applies to our soup kitchens. No more sit down, no more come in, no more group gatherings. But there will be distribution points in very close control that people can still upkeep the immune system.
Leona, what are you doing in that process where you say these are controlled environments, controlled processes? Just give us some idea practically, how are you managing to get whatever it is you're doing done?
All our staff are wearing protective gear as well as gloves. If anybody is coughing or sick, they're not allowed to work with the community. We are also having masks in case some of the people queuing is coughing, then we will take them aside. We are busy putting in thermometers, that's no contact thermometers, that we can also monitor temperature. So that if we do identify people at risk, that we can refer them through our channels to the relevant clinics for testing. For us, it's important, so we're doing a lot of hygiene control, regular change of linens, regular change of clothing. The other thing that we are doing is most of our shelters, the people during the day go out. But at the moment, if people don't have a fixed employment or they don't have a part-time contract, we will encourage them not to leave the shelters during the day to minimize public traffic. We will also monitor that through a card system. So those that do work will have a green card, and if they come back from wherever they work, they need to be screened. They need to say where they were, which work they were at, so that if there is infections at their workplace, that we can immediately be in contact and that there can be two-way communication. All our creches, all our after schools, we have a WhatsApp line that they can contact us if during this period that we don't see them, if any of the children should get sick, or the parents, that we would be notified, that we can put in the relevant contact tracing protocols. So communication challenge is key for us at the moment to make sure that we have access to the most recent relevant data. All our staff also filled in health screenings, nearest to kin for all our shelter people. We're filling in as they come in so that we can always have the most relevant information at hand.
Leona, with regard to your shelters, how are you managing that, especially with the crowd number restrictions, or are there always less than 100 people in those shelters?
Yes, we always have less than 100. We don't believe in big shelters. We don't think it's good a model. So our shelters in Port Elizabeth is at the moment maximum of 70. In Cape Town, it's also in the range of about 90. In Kempton Park, it's actually even smaller, to about 35. And then in Johannesburg, we have a women's shelter that's below 40, and then a men's shelter that is below 100, and another shelter that's also below 100. So obviously at this stage, we will have very strong hygiene control when they enter, sanitation, hand sprays, hand wash, soap, water, so all those basic protocols. And then, of course, we won't encourage group discussions where they can sit closely together and have debates. So we will minimize that control, and we will be wiping the beds and the linen frequently.
Leona, if I can ask you very, very quickly to tell us how the public can maybe help you at this time.
Of course, we need extra assistance, washing powder, cleaning materials, protective gear, any form of gloves that we can have. We believe we're going to run out of that quite soon. Any disposable containers that we can serve food in at these emergency distribution points. Easy food like easy oats, cup of soup, things that's easy to make just with water. Even if we can have extra linen, because we will have to frequently change the bedding, and we don't have enough spare to change as fast as we would like. So that is quite a big call for help, is extra linen, extra blankets that we can do those changeovers, and extra sets of clothes that people can change more frequently, and that we can get that washed and through the cycle as quickly as possible.
Thanks very much there. That's Mould Empower Serve's Leona Pira. That's what they call Mould Empower Serve. MES if you want to find them and offer your assistance.